Welcome. Welcome to the Seams Nutrition Learning Exchange, practical application of Seams Nutrition Common Approach. As people are entering the Zoom room, the Zoom webinar, good morning, good afternoon, good evening. I will invite you to, if you want, to please introduce yourself in the chat and tell us your name and where you're coming from. Additionally, we will be having a question and answer session after our panel discussion, and we will be asking you to drop your questions in the chat box as well. Just giving a minute or two to let people join. I'm Carol Levin, Project Director of the Seams Nutrition Project. And it's great to have you all joining us. Again, please introduce yourself, and we'll also be using the chat box for your questions. So in the next hour, here's what we hope to do. Here's what we hope to accomplish. We will be presenting a very brief overview of the Seams Nutrition work and a recently published guidance document, followed by a 30-minute panel discussion, where we're going to ask panelists to respond to 2 or 3 prepared questions. The panel discussion will be followed by a 15-minute question and answer, and then we're going to wrap up with next steps and where we go from here. So it's great to see you all joining. Let's go ahead and advance to the next slide. So today's objective really is to, maybe go back one. Let's stick on the title slide for a moment. Today's objective of this webinar is to share experiences and showcase lessons learned from a 5-year project, the Seams Nutrition Project, strengthening economic evaluation of strategies for nutrition. And I'll be referring to that as Seams Nutrition from here on out. We want to showcase the lessons learned in applying the Seams Nutrition Common Approach over 8 countries in Asia and Sub-Saharan Africa. And we want to facilitate a discussion with you, with our partners who have implemented and supported the application of this approach on costing and cost-benefit, cost-effectiveness analysis, discuss the challenges we faced and how we overcame them. We want you to be aware of the tools we've developed and some of the issues in applying these tools. And we also want your thoughts on the implication of using this approach in the future to support economic evaluation and multisectoral nutrition strategies, perhaps in projects that you're working on. We have dropped a link to the Seams Nutrition Guidance document. I hope Natasha has dropped that into the chat. We could probably drop it pretty regularly, perhaps, Natasha, so it's easy for folks to find. And we will have links to the publications that we've generated from this project. Many thanks to you again for joining. A special thanks to our donor, the Gates Foundation, and to all of our collaborating partners who are listed on this slide, and to every individual of the Seams Nutrition team that has made this possible. Next slide, please. So multisectoral nutrition sensitive actions we know are critical to achieving the World Health Assembly targets, which are coming right up in 2025. They drive the most impact by addressing the causes of malnutrition, and they are long-term investments. Food system approaches are critical to address the double, triple burden of disease of malnutrition. Decision-making is ideally supported by information. Identifying effective yet low-cost interventions to promote food systems and multisectoral strategies is critical, but evidence on program costs and benefits continues to be lacking. Although there have been recent systematic reviews in the literature shedding new light on the evidence of effectiveness and cost-effectiveness of multisectoral nutrition interventions and integrated approaches to improving nutrition, of what's available, there's still a lot of missing information, particularly on marketing and pricing of healthy and unhealthy foods, demand creation for healthy foods, and in fact, even on supplying more nutritious foods in the marketplace. In addition, the transparency and standardization of the of the existing evidence on cost and cost effectiveness has been poor. Next slide, please. So strengthening economic evaluation of multisectoral strategies for nutrition has been developed to fill this evidence gap. The best and most useful data from economic evaluations of nutrition programs will be data that are robust, data collected using transparent, comparable, and standardized methods, and data that can directly inform decision-making. To that end, we developed a common approach that builds off of all of the standard guidance and methods for costing and economic evaluation, including the IDSI reference case for economic evaluation, the Global Health Cost Consortium reference case for costing and global health, and the Harvard reference case for cost-benefit analysis. So what you see on this slide are 6 steps that are outlined in our SEAMS Nutrition Guidance document that support generating comparable data across different types of complex multisectoral nutrition strategies. In the first step, evaluators align the program under study to a standardized typology and a conceptual model of multisectoral nutrition value. This helps to determine the scope of the evaluation. What is being evaluated, and what is the question you're trying to answer? In the second step, evaluators will describe intervention components by using a program impact pathway or theory of change to help describe those intervention components, such as the specific activities carried out as part of the program, as well as noting the outputs and outcomes along the program impact pathway. In the third step, still building on that program impact pathway, the analyst would identify the specific inputs and resources that are essential to carrying out those activities. This ensures that all relevant costs are collected. And in this step, evaluators can adapt a generic standardized set of data collection tools and Excel data entry tools to collect and analyze their data. In the fourth step, we describe and measure the benefits. This is done alongside a robust impact evaluation and process evaluations that are already being designed and implemented as part of generating evidence on program effectiveness. In the fifth step, evaluators will compare costs and benefits to reflect the relevant question or decision, and they'll use various approaches to combine benefits and consider long-term effects, such as cost effectiveness or benefit cost analysis. And lastly, analysts will clearly present and communicate their results to key decision makers. Next slide, please. So very briefly, we're not really diving into the specific methods. We hope you will look at the SEAMS Nutrition Common Approach document, which does dive into specifics. But very quickly, to get a sense of what it is, basically we collect data to collect information on costs, to complement data on impact and effectiveness. We use a mixed methods approach. Notably, we focus on intervention costs and exclude research costs, except for things like formative research, which go into the design of the intervention. All projects that we're going to be sharing information with you today use the SEAMS Nutrition Common Approach and templates. All projects use sampling and qualitative data collection to complement analysis of financial expenditure data. And all projects combine both financial and economic costs to estimate the total cost for the whole program and for different arms of randomized controlled trials when that was the case. We estimate unit costs for all of these projects where we had data on impact and effectiveness. We also looked at a full economic evaluation to estimate cost effectiveness or benefit cost analysis. Next slide, please. So our panelists today are going to really dive into additional details on the insights that you see on the screen right now. But we have really, across these 8 projects, been able to highlight some of the shortcomings that have been in the literature and to improve comparability across projects. Notably, some of our insights are that to date, We really have been underestimating the cost of complex multisectoral nutrition strategies to improve the demand and supply of nutritious foods and improving diets. We have narrowed the range from previous studies on cost and cost effectiveness. We will talk more about how important it is to include opportunity or economic costs of frontline workers. These can be very high. I'm going to let our speakers and our panelists talk to the rest of these points. Next slide, please. I'd like to take a moment to introduce the settings where the SEAMS Nutrition Common Approach was used. The slide that you're looking at lists 8 projects. They varied in size, scope, and geography. Each aimed to improve diet or nutrition outcomes. They used different program impact pathways and entry points to improve maternal and child health. The 2 things that all these projects had in common were that first, the projects were already being implemented before they engaged with SEAMS Nutrition. And second, they all had a planned impact evaluation. Now, while you scan the various projects, I'll summarize a couple similarities across these. 4 of the projects had very strong behavior change communication components to strengthen the demand for nutritious foods, notably Suhara 2 in Nepal, C'est Levé in Burkina Faso, Train in Bangladesh, and NIPI in Malawi. And our panelists will briefly describe these projects as they answer their questions. But we'll also draw insights from 3 additional projects that focused on improving the supply and quality of nutritious foods in the marketplace. These include 2 projects by ILRI, More Milk Than Pull Push, and 1 by World Fish Idea Project. All of these projects have focused on agriculture or poultry or fish production. Slide 7, please. So while today's webinar will focus on lessons learned and challenges in applying the common approach, we thought it might be nice to share with you some of the results from 5 of our 8 country applications. These are standardized unit costs or average unit costs. And what you'll notice is that the project sizes vary from 5,000 participants in Malawi to tens of thousands of participants in Nepal and Bangladesh, the World Fish Project. But you're also going to notice that the range of the unit costs is higher than many cost estimates in the literature, but it's tighter, ranging from about 112 to 200 per person reach, where we used a common definition of participant to estimate these costs. So just a little bit to get you interested to go, if you want to read more about each of these studies, we have links to the publications that have been shared with you in the chat box. So now, without further ado, I would like to introduce our panel members right now. And I'd like to shift into the panel discussion. So I'm just going to introduce them all at once, and then we'll start with our first question. I'd like to welcome Alo Jelly, a senior research fellow in the Poverty, Gender, and Inclusion Unit at IFPRI. Amy Margolis, a research fellow in the Nutrition, Diets, and Health Unit at IFPRI. Aisha Twalibu, a PhD student at the University of Washington, the Department of Global Health, and formerly she worked with IFPRI and Save the Children. And Kenda Cunningham, a senior technical advisor in M&E research and integrated nutrition programming for HKI. Welcome, everyone. Thank you. All right, so if we're ready to go, why don't we start with a question on really what were some of the key insights and takeaways gathered from you when applying the SEAMS Nutrition Common Approach to costing the project and then integrating that in looking at unit costs or cost effectiveness or cost benefit. Alo, why don't we start with you for an overall, some overall impressions?
Thank you very much, Carol, and thanks for the great introduction. Really delighted to be part of this very interesting seminar. So what I'll do is touch on sort of broadly a couple of challenges when it came to looking across countries, and then focus on one country, and hopefully set the scene for the rest of the panelists to also comment specifically. So like Carol was saying, so one of the challenges we had is that these multisectoral programs are actually heterogeneous in terms of program design and implementation. So they look very different, at least on paper. So the challenge we had was to how do we come up with a framework that will allow us to make comparisons, both in terms of costs and eventually in terms of benefits. couple of the key challenges in doing that is these programs are often platforms. So what do we mean by platforms? They're essentially activities that leverage sort of existing structures to reach different types of people or different target groups. So that has implications in terms of your unit cost calculations, for example, but also the measurement of your benefit streams, okay? So we'll illustrate those two in particular in some of the case studies. So the first challenge for us was really to try and come up with a framework that allowed us to handle that flexibility, but do it in a structured way that would then enable us to map all the costs across the different activities and then the benefit streams across the program impact pathways. And this is where our typology sort of came in. And we were able to sort of develop a common language where all the different projects that have articulated their theory of change in different ways were essentially lined up to this common framework. Having done that, everything else sort of in terms of the conceptual side was then able to slot itself in. Then the challenges became sort of practical. You know, how do we go about collecting data, for example, using different financial systems? You know, each different NGO, each different stakeholder would have a different financial system, different activity codes, and different ways of reporting on financial expenditures. In addition, the challenge we had was that we weren't limiting ourselves to valuing financial expenditures, but also economic costs. And those are the opportunity costs, the hidden costs that are not captured by systems. So that's where our framework sort of once again came in handy, where we were able to actually identify the activity sort of across the whole system, and then start identifying data collection strategies that would allow us to collect data for that purpose. And doing all that, so it's a lot of upfront work, but then you're able to do what Carol was suggesting, really allow you to give comparable estimates of these key metrics. And here we're focusing on cost, but eventually we're also having the same approach on the benefit side. So, and remarkably, the ranges of costs were a lot more narrow than what we find in the literature. And there were other commonalities in terms of the cost structures. For example, you know, most of the projects we looked at were actually sort of focusing mostly on demand creation. So most of the resources were triggered, let's say, towards that demand creation. And now turning more specifically to the Levin project that was implemented by Tanager in Burkina Faso. This is an example of a sort of microcredit sort of platform, but also a multiple platform that included women's groups to roll out additional training activities. Interestingly, it's a co-location model of nutrition-sensitive programming. So instead of sort of integrating all the different training activities, for example, the idea was to sort of leverage existing groups to tailor sectoral specific training. This is what we call co-location. The challenge we had that each individual sectoral activity was implemented by a separate NGO, a local NGO, with very different sort of financial reporting systems. And in some cases, the level of aggregation that was present in the system didn't really allow us to map to activities. So we had to sort of come up with a sort of hybrid approach where we sort of use the most complete data sets we had, map those to the framework, and then use that to create assumptions for the NGOs that didn't have the level of detail that we require. And why was that useful? We were able to sort of identify, for example, the large share of opportunity cost that the co-location model involves, just because you have multiple groups involved in multiple training activities, instead of having an integrated platform that allows you to reach training in a more sort of maybe cost-efficient way. And we'll explore some of the trade-offs associated with that also in terms of the benefits. But I'll stop there. Thank you, Carol.
Thank you, Alo. Let's go ahead and shift to Aisha. Aisha, can you share with us some of your experiences in applying the approach in the Malawi Early Childhood Development Nutrition Project, NEPI? Thanks.
Thanks, Carol. I'm happy to be here. Just a brief background on the NEPI intervention. So the program was implemented by Save the Children in partnership with the government of Malawi. So through the Ministries of Gender, who are responsible for the Early Childhood and Development Program, as well as the Ministry of Health, specifically the Department of Nutrition, HIV and AIDS, and the Ministry of Agriculture. So the intervention integrated some sort of a behavior change communication where we had trainings on nutrition, diets, infant and young feeding practices, agriculture, as well as early childhood development. And we're able to provide startup seedlings as well as so the inputs to community-based childcare centers, which from here on are referred to as preschools. And then the households that had preschool children aged between the age of 3 to 5 years old. So in terms of like some of the insights that we can actually draw from this work, I think there's several, but I would just like to highlight a few, and mainly on the NIPI program. So I think the first insight would be on the variation in the cost of the intervention. So when we talk about the cost per beneficiary, we actually need to clarify who the beneficiaries are and be able to account for all of them accurately. So that is to ask, who are the beneficiaries that we're actually targeting in these interventions? What would be the denominator in calculating the unit cost? So in our case, for example, while the targeted beneficiaries were preschool children, the impact evaluation results that Aulo alluded to actually showed an effect in the younger siblings, making them indirect beneficiaries. So as many of the benefits were actually accrued to this particular group, it was important to actually consider both the direct as well as the indirect beneficiary when calculating these unit costs. The second insight, I think, would be on the key cost drivers. So across the projects that Aulo has actually touched on, and specifically, and then the ones that Amy is going to touch on in a moment, the key cost driver by input was actually personnel. So in the case of NIP, it was actually about 75% of the hired staff within the personnel, 25% was actually from the volunteers, which is actually quite a big contribution when you're thinking about these interventions. By activities, again, because these are like behavior change communication interventions, trainings were actually a big key cost driver on activity. Specifically to NIP, again, because the preschools were required to provide school meals. So the provision of these school meals actually was a key cost driver, taking about 25%. The contributions, which were actually driven by the food donations from the community, as well as the volunteer labor that actually came from them. And I think, the lesson from this could be that, from what we know, many of the programs actually fail to, track or to measure these out-of-pocket expenses or opportunity costs that are incurred by any of the key agents that you have or volunteers. But the SIMS nutrition approach actually proves to be valuable because we're able to measure these opportunity costs by designing specific tools that could actually capture that. And I think the last one would be the one that, well, there's so many, but for now it would be the last one, would be one that Aulo had already kind of alluded to, but specific to NIP in terms of the typology of this nutrition sensitive chain. I think for NIP, the demand creation, again, was also high. So that was about 53% as compared to, increasing supply, which was like about 27%. And then the enabling environment, which would include policy, gender, and all the other different components that we had, that was about 20%. So yeah, those are some of the insights from NIPI.
Thank you, Aisha. Let's go ahead now. We'll shift to Amy Margolis, and she's going to talk about some of the insights from supporting the work in Bangladesh for both the Train and World Fish projects. Over to you, Amy. And the question is, what were some of the key insights and takeaways from applying the SIMS Nutrition Common Approach to these projects?
Thanks, Carol. Thanks, Aulo and Aisha. Raised some great points. And I think to add to that, before I share some of the specific results from Bangladesh, I think one aspect of the methodology, the SIMS methodology, that I found really helpful and I think is really important kind of in applying to these complex interventions is, in many cases, you have interventions that have multiple components, they have multiple sectors working together, and that's really the challenge that for costing, for economic evaluation, that makes this different than other types of interventions. So one key step in this process for conducting the work and conducting the costing exercise is this pretty it is a time-intensive, comprehensive approach, which is starting with gathering all this information from the implementers themselves and really working to understand how the program works. Many times there's kind of an idea of how the program is supposed to work, but in reality, it actually functions in a different way on the ground. So accessing all the potential program documents, including progress reports or M&E, reports, any internal documents that they're willing to share, doing field visits to better understand the program as well. And all of that sets the stage to kind of the first step of the methodology, which is basically filling in an activity tracking sheet, which lays out all the activities involved in the entire program. And that's including every organization that's involved. So as Aulo mentioned, in some of these interventions, they're sub-grantees. And so you need to think about that as well. It's not just the lead NGO who's running everything. You also have to understand how this is being implemented down the chain. If there are other organizations, local organizations that are doing the implementation in different locations. So part of that is taking the time to really document every single activity involved in the intervention by sector, understanding the different cadres involved. Often, as mentioned before, there are these potentially unpaid or low paid extension workers, frontline workers that are involved in the implementation, and you really have to parse out how they are participating, because this becomes more important later on. When you're thinking about interventions like one of the ones in Bangladesh, the TRAIN intervention, which stands for Targeting and Realigning Agriculture to Improve Nutrition, that was implemented by BRAC. So it's a nutrition sensitive agriculture intervention. It had 3 different arms and a control. So it was an additive design. So part of the question there for the intervention was, how much added benefit are we getting from adding new components to a similar intervention? And so it's very important to do that initial step really well, especially in a multi-arm evaluation, because you need to understand the differences between implementation and the arms. So you have one arm that's a control, the next arm had nutrition BCC, the third arm had, in addition to that, nutrition sensitive agricultural extension, and then the final arm had additionally gender empowerment activities. And so when you're doing the costing, you have to really understand which are the shared costs across all these different arms, which are costs that are really unique to each component. So, sometimes that's very clear cut. Okay, there are these gender trainings, that's very clearly for Arm 4, but then there are potentially trainings or home visits that they're delivering content not just related to one aspect of the intervention. They might have someone delivering nutrition messages and gender messages. And so these, you get into the weeds, but it's important because when you come away from it, you're really seeing that a lot of the costs are related to these economic costs that are often overlooked or excluded in different costing approaches. So by incorporating those costs and carefully allocating them both from the financial side in terms of how program staff are using their time. So how much time are they allocating to different aspects of the program? That becomes very important when you zoom out and you see the total costs, and you really start to understand the differences between the different arms and saying, well, maybe it's really the amount of time they're spending at the households. It's the amount of time that the frontline workers are investing. And like I said, those frontline workers and beneficiaries incorporating their time into the economic evaluation is incredibly important. And it's also influential in terms of thinking about sustainability of programs. If, in many cases, this is also true for the IDEA project, which was it was an aquaculture project in Bangladesh, implemented by World Fish, and they had 3 different models. They were looking at an NGO-led model, a private sector model, and a hybrid model. And in both the TRAIN and the World Fish intervention, there were not just one cadre of frontline workers, or in the World Fish case, they were kind of local service providers. And so it's including the various cadres understanding their roles and costing in the time they're spending and understanding variation in the time they're spending is really critical in terms of assessing cost. And also it allows you to do some really interesting sensitivity analyses. And I think that's what we came to, was really struck us in the end when we finally had the total costs and we're saying, okay, well, you know, a very large amount of these costs are really coming from the economic costs, from the time invested by beneficiaries, from the home visits. And then when you do the sensitivity analyses, for example, with train, we saw in a base case, those economic costs could range from a low of $150,000 to $800,000. Depending on how much time just the beneficiaries were investing in the program. So when you start thinking about that and you think about how these programs can be sustainable, it really becomes a critical issue to think through. You know, are these frontline workers being compensated for their time? Are they covering the out-of-pocket costs? If they're, you know, I think maybe Kendall will speak to this as well, but often you're having geographic variety and, you know, great variation. For example, in Nepal, if you have households that are extremely difficult to access in some regions, that's something that you have to take into consideration when you're costing in terms of thinking through sampling, which we may get to later.
Great. Thank you, Amy. And so that leads us to Kenda Cunningham, and she's going to talk about her experiences with a scaled-up program, Suahara 2 in Nepal. Over to you, Kenda.
Thanks, Carol, and thanks to all the panelists. It's actually quite interesting to hear how similar the issues were. So, as has already been alluded to, I think the biggest difference for Suahara versus the trials that you've been hearing about, I think there are three major differences. One is scale, one is timeline, and the last is geography. So on scale, for those of you who aren't familiar with the USAID-funded Suahara work, it ended up being, due to earthquakes and COVID and other factors, a 12+ year intervention. And that was handled by more than 100 implementing partners. And you can imagine the types of variation that I think Aulo, Aisha, and Amy have already talked about just become magnified at that point. The other thing is the pure scale of the project. So we were fully operational in 60% of the communities of Nepal. To give you some sense of what that means, from trying to understand beneficiary and frontline worker cost, we have about over 11 million individuals registered into our database. We have 2 million households that we know we engage with in at least one program activity. Some of these live in extremely remote, the tallest mountains in the world, and some live in the flat plains that you can reach within a 5 to 10 minute walk. And so all of this, you know, the geography, the scale, and the timeline, I think brought up a lot of anxiety originally around whether the approach could even be applied. And I have to say, we got a little bit lucky that some of the IFPRI projects were further along than Suahara in the evaluation and in the data collection. And so I remember lots of meetings with Carol when she would say, you know, Aulo and his team just did this in this scenario, and then we would try to think of the best way to adapt. And so to me, part of the exciting thing right now is that even with those of us who have now applied it, and there are lots of lessons learned as you're hearing, I do still feel like we're at the beginning, and there's a lot more room to grow. So I'll just share kind of three highlights for us. One is that it has really helped to have documentation of the variation in cost, because we would hear this informally from field staff or from Kathmandu workers traveling out to the community. But there are donor and organizational policies about per diems and these kind of things. And I think really getting the data to support and to make kind of fairer, in quote, decisions about how to allocate resources is quite useful. And it's something we wouldn't have had without the project. The second is the sheer recognition that economic cost, if we accept all the assumptions we had to make this possible, were half of the program costs. And it really does highlight that the estimates are not just a little bit off, but pretty wildly off for actually fully understanding how much it costs to get the benefits that we have. And the last thing is, when you have a very long projects, science and the world of development changes. And the truth is our evaluation in 2010 was planning to have stunting as a primary outcome. And I think we've all kind of moved away from that. And Carol came to us with this new project. At the same time, we were forming an advisory committee for our main evaluation. And we were having lots of debates about what benefit from SWOHARA even means. And so I saw this as extremely complementary to the main evaluation. And I think there's still a lot to be uncovered. We've actually been talking about additional analyses to look at more of the intermediary outcomes to see if estimates change at all. But I'll stop by just saying that what's interesting is despite the perhaps uniqueness of SWOHARA versus the different trials, it's quite reassuring that the estimates for the project came out in the middle of all the rest, and the challenges we had seem to be pretty similar to the other projects. So I think, I don't know, kudos to you, Carol, for somehow pulling it off.
Well, thanks, Kenda. Really kudos to everyone for trudging along the last few years. Thank you, panelists. We're going to move to our second question, and we're going to just ask two of our 4 panelists these questions for time. But based, as Kenda noted, many of the challenges are shared across all. So the next question is, what were some of the challenges in applying the SEAMS nutrition approach for both data collection and analysis? And feel free to touch on planning or sampling or capturing the variation in costs, data collection frequency, et cetera. So I'm going to ask Aisha, we'll start with you, Aisha, to go ahead and share some of the insights on that. Thank you.
Okay, thanks, Carol. I think in terms of challenges, the main one would be, like when you think about NEEP, it was actually a retrospective study as compared to the other trials that we've spoken about, which actually meant that we had not set up the cost analysis before the study. And it had to mean that we had to return to these communities to collect additional data, which was something that was quite challenging at times. So for example, when we're looking at that, the preschool level, they did not have detailed day-to-day expenditure records. But to address this, we used existing data and caregiver recall data from the interviews that we conducted with them, which we're able to use to estimate the incremental cost of the intervention. But also knowing that we had data from the impact evaluation that used mixed methods, the qualitative aspect that we included in terms of the opportunity costs that I mentioned earlier, as well as that Aulo mentioned, was actually able to include this data within that. So while there were these challenges, like I said, we're able to make the assumptions that could actually be tested as well as validated over time using this impact data. And being someone that was actually involved in the intervention as well as the research side of this, it actually did help in that any gaps that were there, I was able to actually fill them with ongoing field work, which was pretty much all throughout. In terms of the implementers side, again, financial data, it's often recorded, under broad categories. So like for Save the Children, I think it was things like personnel or supplies without really having the clear links to the specific activities or inputs that, SEAMS actually does ask for. So shared costs such as, training, transport, also made it difficult to really allocate these expenses accurately to the specific interventions. But again, this is where the SEAMS nutrition, mixed methods approach is actually quite beneficial in that we're able to use the financial report data alongside the microcosting estimates to fill any of the gaps that would actually exist. And then lastly, for the Siliver, the Burkina Faso project, because they had multiple subcontractors, it wasn't always possible to get disaggregated financial data from some of the subcontractors. And again, that proved to be very challenging. But with additional data collection, we're able, for example, to allocate time to the different activities and inputs with the interviews that we had conducted.
Thank you, Aisha. That was very clear. And Amy, over to you. Let's just try to keep it to a couple minutes per answer so we can get through the third and final question. Thank you. Over to you, Amy.
Sure, To add
challenges.
to that, build on what Aisha was saying, I think building a good relationship with the implementing partners as well, because you really need a lot of access to data, and sometimes there's a little bit of reluctance to share internal program data, particularly expenditures. And in some cases, once you finally get the expenditures, you have kind of thousands of lines of kind of inscrutable cost categories. And so one thing that is really helpful, I think we'd have this expenditure coding sheet as part of the methodology that really helps you automate some of that. But you still kind of need to have that relationship, particularly with someone who understands the finances, understands the expenditures within the organizations, who can give you some orientation. So you can go through and say, you know, XYZ 345, what is this? In some cases, when you're really lucky, like with HKI, they have a more clear system for their financial codes, and you can automate most of it. But you still really get in the weeds in terms of trying to parse out what these cost codes are and making sure they're coded to the right categories to get the costs right. So that can be time consuming, but again, that relationship is really important. And the better the relationship is with the implementer, the more information you can get. So I think that's really important. And then to go back on the sampling side, particularly in terms of the economic costs, I think with Train, one thing that we realized when we did our first, I mean, certainly doing field visits is really essential. You know, I think in theory, you could do this maybe without, but really part of the method is you really have to go and understand the program, collect the costs, do interviews in the field. That's a critical part to really do ground truthing and understand how the program's being implemented and what the actual costs are, and talking to the actors involved in the program, because often things come out that the implementers don't share once you talk to the cadres on the ground. And I think with Train, for example, when we did collect those economic costs for the frontline workers, there was the range was quite large. And so I think it raised a flag for us and said, you know, is this really the typical range of costs? We think we actually need to go back and do more investigation of the range of these frontline worker costs to make sure we can assess, you know, kind of what the average is and the ranges, so we can do some, also on the back end, some sensitivity analyses. So we went back and did more, and then we were able to kind of narrow that range and better understand also the variation. And so that goes back to sampling as well. So really understanding the intervention and thinking, where is the possible variation with these cadres? Like, is there geographic variation? Is that potentially a cost driver? Are they having a great deal of out-of-pocket costs because they have to pay for transport themselves? Are they getting a stipend? So I think that, you know, ideally you do that up front and really plan out, just like with Train, we planned out what we thought we were going to do in terms of the sampling, and then you realize as you go through, okay, maybe we're not capturing enough, we have to go back. And the good thing is when you go back, you can also interview the actual staff members. And for example, in the case of with the World Fish Project, really spending a lot of time with the staff at HQ and basically sitting down in a room and going through kind of how everyone spends their time, and having conversations and sitting down with the frontline workers and allocating costs. And it's, you know, it's time consuming, but you really get a great picture of how the program's actually working on the ground.
Thank you, Amy. And as I mentioned, we're only asking 2 of our 4 panelists about the challenges. Having been involved in HKI Suhara 2 at a scaled up program, we could talk all day about some of the challenges, especially during COVID and working in such a large program across such a geographically diverse setting. Feel free to ask some questions later about challenges in a scaled up program like SEAMS. But we're going to move on to our 3rd and final question and then open it up to all of you. We see some questions coming in. This question is for Alo and Kenda. What kinds of challenges did you face in combining evidence of effectiveness or your impact with the improved estimates of total and unit costs. So let's go ahead. Let's start with Kenda, something different. And unless you want me to start with Alo, but Kenda, over to you.
Yeah, Carol, that's fine. I think I was gonna focus on the next question related to the use of it for future programs. But I can speak a bit to it because as I was mentioning in the earlier slot where I spoke, we just wouldn't have had this kind of data. I think I can merge the two questions. We wouldn't have had this kind of data to really understand how large the economic costs were. And that really helped in interpreting the evaluation findings as well. You can see from the evaluation that where we had the biggest effect was also where we spent the most money. So household and community level behaviors, yes, this is what cost the most, both financial and economic costs, but it's also what paid off for the behavior change that in sometimes is striking. I mean, moving sick child feeding, moving minimum acceptable diet, minimum dietary diversity by 16, 17 percentage points is huge in comparison to other SBC evaluations. But this didn't come from nothing. And so I think that was really important. I also want to echo what Amy said earlier, that for us, one of the challenges in thinking about it is, especially as we moved forward to write, proposal for the follow-on project was, what do you cut and what do you keep going with? And it's really hard when I would kind of off the top of my head say that 70% of our activities were very integrated. So to label a home visit as a nutrition versus a wash versus an ag visit was nearly impossible. And I think, yeah, it would be great in the future if we can find a way to disentangle those and have a little bit more comfort with where those goes. And then the last thing I'll say is that definitely for us, this was very relevant for future programs and policies. I mean, it influenced per diem decisions, staffing decisions, targeting decisions, and so on in the new project that I started up called USAID Integrated Nutrition Activity. And I do think it's the beginning. I think there's a lot of future work, more publications, more webinars, more in-person meetings to help other programs that weren't a part of the SEAMS Nutrition learn from what we did, and help governments also think through how they can do similar work with their multisectoral nutrition plans.
Thank you, Kenda. And now, Alo, for the final question, we're going to move into, after this question, into probably, we've got a bunch of great questions coming in to the chat box. So over to you, the kinds of challenges that we faced or you faced in combining costs with impact and effectiveness. And
Thanks,
maybe for the one that worked and some of the ones that didn't work so great.
Right. No, it's true. I mean, so thanks very much. These are all great questions. And I think so tying it back to the challenges we had. So at the end of the day, the idea was to combine cost and effectiveness to inform decision making, right? And what can we give guidance to policymakers in terms of investment choices? So, the challenge we had, once again, is that these programs were very different, both in terms of activities, but also in terms of intended effect. So, the idea of mapping it to a conceptual framework that aligned each intervention and each, let's say, typology to a pathway kind of was the starting point. The challenge was also compounded by the fact that traditional methods for economic evaluation that we use in health, for example, do not lend themselves for programs like these multisectoral programs that have multiple benefit streams that don't immediately map to the traditional outcomes that health sector value in terms of, for example, cost effectiveness like DALYs and things like that. So what we opted to do is to come up with ways of, one, making relative comparisons across programs. So find a way of essentially leveraging the trial data that was available to allow us to create indices or scores that were created in the same way across the different programs, and essentially score each of the program's performance based on essentially counting the effects along these different pathways. And then, where possible, where standardized metrics existed for outcome measurement, actually get a sense of the effect sizes as well. So we had a count score that said, did the intervention have an effect or not across a whole range of pathways? And then we coupled that with another metric that said, okay, if you had an effect, how big was the effect? And why was that useful? Because that allowed us to have variation in program performance across the programs. Okay, so we could actually get a cost per unit return of whatever score we had that had enough variation that allowed meaningful comparisons, like the ones that Kenda just mentioned. So you could actually say, actually, a lot of the returns come from the demand side pathway, and then you can tie that up to the cost drivers, for example, saying that the majority of the costs are actually from the demand side. The other thing we did was try and work with traditional modeling tools to extend them to cater for the valuation of certain metrics that we know these programs could deliver, like, for example, diet and the diversification of diet, which was consistently measured and maybe had a lot more sort of salience in terms of the primary purpose of these programs. The challenge was then how to incorporate the diet, and particularly dietary diversity, on the modeling pathways that then estimate the different returns. But we actually were able to do both. And then the interesting part was that, of course, these programs, there was a lot of variation in terms of effectiveness, not just cost. So we had very effective programs and programs that were not that as effective as others. So, providing that nuanced vision of how these results look like allows, policymakers to understand some of the implications of their decisions. Over.
Thank you. So what I'd like to do, and we were hoping we could, we do have, Aisha, if in one quick minute you can sort of share really with the Malawi NEPI, really quick minute. We've got some great questions coming in and we want to let folks know where we're going from here. So Aisha, what I'd like to ask to you is just as we sort of transition into Q&A, just, how, and Kenda, you answered some of this, but how were these results used in the context of Malawi? And then we're going to shift to the audience questions.
Thanks, Carol. This is actually one of my, happy places when it comes to talking about this. So as we know, actually NEP was able to show that it was actually affordable than we expected, costing about, I think, $41 per beneficiary per year. And what the World Bank actually did was to also conduct their own cost-benefit analysis, in which they did find that the return on investment was actually even more stronger, where for each dollar invested, they're actually going to get an economic return of about $2.4. So based on this economic rationale, as well as the impact that Aulo talked about, they actually decided to fund the Malawi government, and they scaled up the intervention to 13 districts out of the 28 districts in Malawi. So that was for like 6 years, and it started in 2020. Again, COVID had an issue to that, but again, that was really, really great. So I think the key takeaway from that was that during the policy discussions that we had with the government, we're actually able to highlight some of the sustainability results that we got, to say, okay, so some of these things are sustainable, but some of them not so much. So using that cost data, we were able to guide the government to be able to inform, their budgeting as well as their planning, where they could make these slight modifications in the program. For example, adding refresher trainings to ensure that those, some of the effects were maintained over time, as well as, providing the startup inputs. So yeah, thanks, Carol.
Thank you. Okay, so thank you, panelists, for sharing your insights. We're going to turn, we have 3 questions, we sort of have 4, but we answered one offline, but I'll tell you what that was about. But let's go ahead, at time permitting. We have 3 questions. I'm going to start with sort of the easy one first, which came in last. And this question, thank you, Lonnie Trenat, for asking this question. So we've talked about we're using financial expenditure data. I just want to kind of preface this quickly and say, when we started this project, we had no idea that the bulk of our analysis would be based on actual financial expenditures. We really thought we were going to be going into the field and doing microcosting. But as it turns out, a lot of multi-sectoral nutrition programs are funded by donors. And so they're moving through international NGOs and then through national and local NGOs. So the question was, what is the range and level of effort that was spent on organizing the accounting or the financial expenditure data for each of the studies to code the accounting data according to the SEAMS Nutrition Cost Centers? I'm gonna pump that one first to Aisha. I can also answer the question having lived through 8 of these. It's not trivial, but it does depend on the size of the project. Over to you, Aisha, a response to this question.
Yeah, I think for a quick one, it's a lot of time. So for NIPI, for example, we were lucky that I was a full-time employee, which meant that, a quite significant part of my time had to be spent on organizing this. For the others, so that would be Levin. Currently, again, one of the scale-ups in Malawi is actually what we call Maziko, that Aulo and Save the Children and Give Directly have integrated, cash transfers to do this. It's a lot of time. I recently came back from Malawi where I spent 5 weeks doing, field data collection as well as meeting with Save the Children staff and Give Directly to look at the financial data. And that 5 weeks was not even enough because post that trip, we're still in touch. So I would say a lot of time.
Yeah, thank you. Let me give you another concrete example. So for the World Fish, which was a scaled up project, 3 years, thousands of lines of financial expenditure data. We hired a 50% research assistant, and she worked for, we had other people coming in to support that activity, in all fairness, but it was about a year at 50%. So on a scaled up project. So obviously that's, it is a lot of time. The second question is cost estimates or estimates, and there's a variation in the estimate on actual program costs and variation in data collection and analysis methods. While this variation may be captured in sensitivity analysis, a single value may lead policymakers or readers to misunderstand the certainty of the results. What are your thoughts on the recent practice of reporting a range of costs? I think there was the original question talked about a specific method on quartile, but it's not printed here. You're absolutely right. I think our first, I'm gonna answer this question and invite others to join in. We certainly can start to look at other methods to generate this. Point estimates are dangerous, but I want to say that point estimates are exactly what are being used today in models that are determining resource allocation for nutrition. And those point estimates have been grossly underestimated, and therefore you're going to misallocate resources, thinking and underestimating the resources you need to get the benefits. To give you an example, not to pick on this, but until this study, what was being used in models for behavior change communication was around $4 to $7 per beneficiary reached. We've debunked that. It's just simply not true. It's in the range of $40, $50, $60, or $100. So, if you want to see change, it's going to come at a price. You need repeated visits. You need multiple channels. So I think that in the next work that we do, we can certainly explore capturing variation and giving a greater range. So thank you for that comment. If anyone else wants to jump in, let me stop there to invite your response. Otherwise, we'll go to.
I think you captured that. I was just going to say that is definitely something we did in the economic cost specifically. Not as much in the financial costs, but certainly in economic costs, we were always capturing a wide range in terms of the actual data collection in the field before we were generating any estimates.
Thank you, Amy. And a final question, there might be some that just came in. Have you measured the benefits of the evaluated projects and compared them with the per unit costs? So one of the things I mentioned is that in developing this approach, we wanted to be integrating cost data collection alongside impact evaluations. COVID interrupted a lot of those evaluations and delayed them. And in fact, in all projects, impact evaluations were completed, and we have measured cost benefit estimates in our Malawi paper, which is available in our list of publications. Maybe Natasha, you can put that in there. We do have plans. We really got our impact estimates a little bit late to do the economic evaluations for all the other countries, but we will be doing more work on that as we move ahead. And that may segue us, given the time constraint. I know people have to drop off. I want to thank everyone for their questions. We got to most of them. But I'd like to shift to Alo and just say, what's next steps? Where are we going from here? And then close this. I want to thank the panelists for a great discussion and shift it over to Alo for next steps and where we're heading.
Wonderful. Thank you very much, Carol, and thank you very much, panelists, for this very, very rich discussion. And we're delighted to say that we will be able to continue this work in terms of actually extending the SEAMS nutrition approach to actually fully capture and fully try and account for women's empowerment. There's a new grant that's just been released that will allow us to do that and work over the next 3 years to really bring in the wealth of information that has been accrued by on women's empowerment outcomes by the GAP team, for example, and try to really extend this sort of economic evaluation to fully factor for women's empowerment. Thank you so much. And keep asking us if you have any outstanding questions. You know how to reach us, and we'd be delighted to continue this conversation. Thank you.
And thank you to R4D for hosting this. Natasha, thank you very much. Leif, we really appreciate it. And thank you, panelists.
Bye-bye. Thank you so much.